Hello everyone. This year, the theme of Cancer Awareness Day is Close the Care Gap. The Cancer Awareness Day falls on 4th of February and recognizes the power of knowledge and refutes the power of assumption. What it technically means is that cancer battle can be won if you have the right knowledge and right awareness. So two aspects which we definitely need to know is whether cancer is preventable, and the second is early detection is the key. Early detection, we know, can cause cure in most of the situations. We talk about curable cancers when we talk about pediatric cancers, when we talk about blood cancers. Cancers like thyroid, prostate and breast cancer also have remarkable cure rate. So the first question is cancer preventable? As an oncologist, we all have recognized that yes, cancer is a lifestyle disease. We know about changing lifestyle, more westernization, more urbanization, change of our food patterns, which all have led to cancer. So yes, a good healthy diet, as much as possible to reduce the stress levels. Whenever there's an occupational exposure, recognize the exposure and your employer can offer you regular tests. Try to stay away from addiction as much as possible. And then one important thing is, if there is a family member with cancer, then you understand whether you have a history which significantly makes you actually at risk of cancer. Can you do any test to cut your risk? Then one more aspect is finding precancerous states. These precancerous state can happen in oral cancers, head and neck cancers. It can happen in breast and cervix cancer. And all these cancers, if they are diagnosed in pre-malignant state, most of these are preventable. So we don't even reach the state of cancer. The second is cancer detection or cancer screening. Now, cancer screening is technically a term which is recognized for asymptomatic population, which means a healthy population which does not have any symptoms. And these are common cancers which can be detected with very simple methods. And these type of cancers include breast, cervix, it can be prostate or colon cancer, and lung cancer in high-risk individuals. So all these cancers have very simple tests. A blood test like a serum PSA test for prostate. It can just be a stool test to recognize whether there's a possibility of a colon or a rectal cancer. Then for high-risk smokers, long-standing smokers, if required, we do a CT chest at a certain age. For breast cancer, an ultrasound or a mammogram is recommended. For cervix cancer, pap smear or HPV testing is recommended. So what we all know is recognize your problems early. Any of these tests, if they show an abnormality, an oncologist would try to order either an FNAC or a biopsy. Now the biopsy is done from the affected part, and we try to look for expression of certain biomarkers to direct our treatment adequately, such that we know that there are minimum side effects and maximum advantages. The basic way of treating cancer includes either systemic therapy. This systemic therapy can be in the form of chemotherapy or immunotherapy or biologic therapy or hormonal therapy. The next big chunk is surgery. We are moving towards an era of more focused surgery. We try to look for organ conservation surgery. For example, in breast, we might do breast conservation surgery. For a gastric cancer, one might offer partial gastrectomy, a partial cystectomy for a bladder cancer, and so on. Radiation, again, in the current era is more focused, and we talk about stereotactic radiation and other type of radiation which are with computer-based planning with lesser side effects. All these treatments are integrated in a certain way, and a plan is generally offered by an integrated method called tumor board. What we have understood is that in 2022, we talk about precision oncology, and we have to customize care for every individual. Even one type of cancer and one particular stage could have multiple treatment. So a breast cancer which has a certain biomarkers may actually behave very different versus another breast cancer of the same stage and different set of biomarkers. So we do techniques like next generation sequencing, in which we try to find out biomarkers and we find out actionable mutations which can treat the cancer well. This is the battle of cancer till now which we have fought and which we need to win. Thanks so much.